I am Dr. Chakravorty. I am a diabetologist. I am practicing in the field of diabetology for the last 15 years. I have traveled around the world and dealt with the people suffering from diabetes over a long period of time. We all know that India is fast becoming diabetes capital of the world. The time has now come to join hands and work collectively in the field of diabetes and provide a disease-free society. The diabetes, as you know, is a disease where patient education comes at the forefront, followed by medical treatment. So it is my endeavor to provide you all with the maximum knowledge about the diabetes through this media. So what is diabetes? All of you have to know. It's a metabolic disease. A disease which causes hyperglycemia, means that the sugar in the body is high and it is not being metabolized properly because of either absolute or relative deficiency of insulin in the body. As we know that there are two types of diabetes commonly identified. First is type 1 diabetes, which occurs commonly in children, and the second one is type 2 diabetes, which occurs commonly in the adults. However, there are a lot of overlapping between these two. Now, how do we identify whether this diabetes is there in your body or not? There are several symptoms with which you can identify. You can have a family history of diabetes. You may have certain symptoms like increased frequency of urine, or there is an increased hunger, what we know is known as polyphagia. So polyphagia, polydipsia and polyuria means increased urinary frequency. Now these are the cardinal symptoms, what we call. There can be other symptoms as well. Other symptoms include progressive weight loss. There can be delayed wound healing. If some wound is there, it is taking a longer time to heal those wounds. These are the usual symptoms. Now, once you have identified these symptoms, then you have to classify the disease, get your blood sugar tested and establish the diagnosis. We can also test the blood sugar over a period of last 3 months with what is known as glycosylated hemoglobin or HbA1c. These days we have something called Indian Diabetic Risk Score. You can predict the risk of getting diabetes by doing certain score. I will show you something. So with this particular instrument we can find out whether you are at risk of developing diabetes or not. So as you can see, this is known as Indian Diabetes Risk Score. In this, what we have done, we have scored this into 4 groups. First is an age, second is abdominal obesity, third is physical activity, fourth is family history. By scoring each of them, if the score is more than 50, you are at risk of developing diabetes. So to continue with our discussion, so once we have diagnosed the diabetes, we have to see whether you have developed some complications or not. For that, we have to conduct certain investigations in order to find out whether your target organ damage has already occurred or it is in the process of developing so. The target organ damages include examination of the eye, examination of the cardiovascular system and examination of the kidney. Simple tests can be conducted for each one of them and we can find out whether they are at compromise or not. Having done that, we have to now institute the treatment. In the treatment, we have 3 groups of mainly medicines. One of them is the oral hypoglycemic agents. Second is the insulin therapy and various newer forms of therapy. Before we go on to the therapy, we have to see 2 more things. One is the diet and second is the physical activity of the patient. Lifestyle modification constitutes a major part of the treatment. Every individual, irrespective of the blood sugar, first must be given a lifestyle modification. Only then we can go for the medical treatment. In the lifestyle modification, you have to ask the patient first of all his level of physical activity which he is already carrying out. Then you have to individualize the treatment on each patient depending upon his level of physical activity and age. Beforehand, you will have to do a cardiovascular examination and find out whether the patient is able to carry out that much of physical activity or not. In general, 150 minutes of brisk, moderate physical activity in 1 week period is recommended. In general, 150 minutes of moderate intensity physical activity per week is the recommended dose. Now, apart from the physical activity, you will also see for the diet. The diet is usually calculated in the form of calories depending upon the activity of the patient. Whether the patient is a sedentary worker, whether is a manual laborer, depending upon that, the diet is usually calculated.